up my agenda. Well, welcome everyone. Good afternoon. Um, I'm Lara Parrilla. I always forget what my actual title is, but I think it's actually president, right? That feels like way too official. I'm president of the Health Planning Council.
Yeah.
And I am needing to pull up the agenda, but I think I'm starting with asking folks to approve minutes. Nicole?
Correct.
Okay. Please forgive me, folks. I was supposed to be out of town today and my plans changed. Um, so I'm not as organized as I'd like to be. So please forgive me for that.
Laura, I have to tell you, I'm very grateful that you're able to attend. I couldn't respond to Nicole's email about chairing the meeting because I'm recovering from some sort of a cold, and you probably don't want to listen to me for more than a minute and a half, maybe not even a minute and a half. So I'm very glad to see you. Um, I'll click on and off every once in a while because uh, anyway, but I, for one, am very glad to see you.
Well, I'm happy. I'm happy to be here with you, and I hope that your cold gets better. I think a lot of people are experiencing colds right around now. Okay, so the first item is approval of the February minutes. Can I have a motion to approve?
I'll move him.
Thank you, Frank.
You bet.
Anyone second?
There, Karen. Thank you. I got Karen.
Thank you, Karen. All right. Any anyone have any changes to the agenda?
No, to the minutes.
To the to the minutes. Thank
I'm
you.
so glad you're here, Laura.
I think we should do this together. I'll just make the mistakes and you correct me. Um, and all in favor of approving February minutes?
Aye.
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 Any abstentions? Jen, is that your leftover in favor? I think so. Okay. Any opposition? Okay, thank you. Always takes me longer than it should. All right. Well, I'm very pleased to introduce two of my favorite colleagues, Samantha Hilson and Anushka Bargave. Am I saying your last name correctly? Okay, great. They are going to be presenting on the Tompkins County Whole Health Community Health Improvement Plan draft. And I don't think that requires any further introduction. I think you two are going to be taking it away. And then we're going to have some breakout groups for discussion. And Nicole, am I missing anything in terms of? Okay.
No.
Okay. Wonderful.
No,
All
no
right.
in-depth intro since they're both common attendees or a part of our advisory board.
Mhm.
Okay, thank you, Lara. And yes, joined by Anishka, our public health fellow. And we are going to give an overview of the community health assessment process and sort of how we have gotten to where we are now, um, and then get into the community health improvement plan, which is like the action plan for this process. So thank you all for joining. Some of you on this call have also attended some of the partner convenings that we had as part of this process. So hopefully it's not all too repetitive for you, but we wanted to just get everyone on the same page for this presentation today. So we will start with that. All right, so Anushka, is going to share her screen. Would that be okay? All right. And we will have some breaks in the slides for some discussion and questions, but feel free to put anything in the chat or just raise your hand. I think Nicole and Lara especially can keep an eye on that since I can't see as much with the screen up, but that would be fine. Okay. So our community health improvement process, we called Chai Tompkins this round. And it is about a 5-year cycle. Going forward, it really will be more of a 5-year cycle. And it includes bringing together different aspects of our community, from public health to social services to health and human services, to assess unmet needs and inequalities or disparities in our community, propose strategies and interventions, and then continue to monitor and track progress in these areas. So the purpose of the process is to identify key health challenges in our community, determine these gaps and disparities, prioritize strengths and different assets and resources that our community has, and then overall to advance health equity and making sure that everyone has the opportunity to reach their optimal health and well-being. So this is very much in line with our mission at Tompkins County Whole Health, but also many of your organizations who are on this call today too. So many of you maybe have remember seeing this graphic from a framework that we adopted for this round of the community health improvement process. That is called MAP 2.0, which is mobilizing action through planning and partnerships through NACCHO, which is a national public health organization. And so they have this nice roadmap graphic that goes through the 3 phases of the framework that they lay out, which is building the foundation, developing a community vision statement we did during that time, telling the community story is more the traditional community health assessment, which is when we review data about our county to understand, the health status of the county. And then the last phase is continuously improve, which is that monitoring and tracking of what's going on. And then we developed for our second convening that we had, we developed our own sort of roadmap graphic so that folks could see in a little more detail where we were during this 2-year process almost. This process was a little bit longer than we've had in the past, primarily because we adopted this framework from MAP and really we took a lot of time to review the framework and understand, what pieces we were going to do of it. So this lists out some of the more specific activities that we conducted. So if you move along, we're now actually in phase 3, which is really developing and refining this action plan. That at the end of phase 2, which was the end of 2025 in December, we submitted the community health assessment and also a draft of the action plan. And also when you get these slides sent to you, but we can also drop the link in the chat. There are a couple links on these slides that take you to our whole health website where you can now view the full narrative or report of the community health assessment. Ted, who's on the call, has done a great job breaking it into sections so that you can download different parts and read through it. It also then takes you to the some of the data and priority areas that we've been breaking out and highlighting on the website so that you can interact with it there too and review things. So that's available for you, and we will go into this a little bit more later in the presentation too. Next one. And just to highlight the organizations who have been involved as part of our steering committee. So they have met anywhere from bi-monthly to monthly for the majority of the past 2 years or so. It's been representatives from about 10 organizations, many of whom are here today. So thank you. All right, next slide. And that was let's see. Okay, so this again is the MAP process, and that phase 2 of the process about really delving into data about our community involved 3 assessments. So, and we did do each of these assessments. There was a community partner assessment that many of you on this call completed. It was a survey that assessed different things around or had questions about organizational capacity, where organizations work in the space of equity and health equity, and what areas you focus on sort of related to this larger process. Then we did the community status assessment, which again is our more traditional review of secondary data or like state level data, census data about our county. And then the community context assessment is meant to be qualitative data or more, stories and information directly from our communities. That we also did work on this process, and Anushka will talk about that in a few more slides. And so those 3 assessments were brought together, the findings from them, to identify different themes and issues, and areas where we identified disparities or differences across different populations. And then we developed something called issue statements, or almost like problem statements around these different areas. And then in conjunction with that MAP framework that I've been talking about, we also align this process with the New York State Prevention Agenda and Prevention Plan, which is the New York State Department of Health level review and report based on different health factors across the state. And so the CHA and CHIP process is really is a requirement of all local health departments that is reviewed by New York State Department of Health. And so New York State uses this model of social determinants of health or social drivers of health across these 5 different domains. So education, access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. And so these areas you'll see throughout our report and the rest of this presentation that these are the overarching areas that then different issues and different health challenges fall within them. And that leads us to the priorities that we're selecting for the action plan. So there are lots of layers of, I don't know, jargon and sort of public health terminology in this process. But if you have questions about it, or hopefully we are laying it out in a way that you can grasp enough. Okay, so I'll turn it over to Anushka to go into more of our data sources.
Thank you, Sam. So much of this process consisted of data collection and data analysis. So we had three different kinds of data sources, one of which was primary data source. And as a part of the community status assessment from the MAP 2.0 process, which we saw earlier, Tompkins County Whole Health launched its community health survey on January 23 of 2025, and that remained open for a month, which closed at the end of February. And the goal of the survey was to collect comprehensive data on various health indicators and social drivers of health within the community. So the survey was eligible for residents over 18, and we got more than 1,800 responses on this survey. So this is one of the findings from the survey. So the survey asked a question on what are the most important factors that create a healthy community, and affordable healthcare, affordable safe housing, and a clean environment emerged as the top three important factors. Another data point that was surveyed was barriers to accessing healthcare services, which included primary care services, dental health services, cancer screening services, mental health services, prenatal services. So, and they were factored in based on cost, insurance, long wait times for appointments, lack of providers, lack of in-coverage network, or difficulty making an appointment, and transportation. So as you can see, cost, lack of providers, and long wait times for appointments were the top three barriers that people are facing in Tompkins County. As for the qualitative data part, this was part of the community context assessments that gathered lived experiences, qualitative input, and local history to understand deeper factors that shape health. So we conducted qualitative interviews in collaboration with Cornell University MPH professor and students. The goal of these qualitative interviews or the study was to evaluate the barriers and facilitators of health programs used by birthing parents in Tompkins County, and 26 birthing parents and providers who were over 18 years of age and who gave birth after January 1 were included in the study. So this is where we got the bulk of our qualitative data. So the second data point included in the process was secondary data. And this secondary data was collected from different state and federal and local data sources, and alongside the state level and federal level data, local data sources were also like essential in contextualizing health trends and identifying community specific inequities. And then here you can see a snapshot of the prevention agenda dashboard. So the state really collects data on different health indicators and then sets objectives that the local health departments have to try to meet by the year 2030 to improve health. in the community. So this is a list of few of the data sources that we use, like census and few from the state and behavioral risk factor survey and the community level youth development evaluation survey, or we call it the CLIDE, which is a local survey. So I guess I'll pass it back to Sam to discuss the health issues that we explored in this chart on a deeper level.
Thank you. So what's listed on this screen, again, is broken into these 5 social determinant of health domain areas in the prevention agenda. And then the bullets are listing out the health issues within each of these domains that for Tompkins County, we identified as having, again, disparity or difference across populations, or data showing that compared to the rest of the state, for example, that Tompkins County showed some difference there. And why is that? Or like an area that we would want to work on in this improvement plan. So this here is listing about 12, I think 12 or 13 issues. The prevention agenda for New York State has like identified about 24 issues. So just to give you some context, that through our data review, we defined or narrowed down to about half of those issues as rising up for our county. And then the next step is that then we decrease them to 5 areas that we are going to focus on. So this is showing from our second partner convening that folks who participated were able to review some of the highlights of data from these different issue areas. And we're actually going to go through some of this data today as well. So then the 5 priorities that were identified for the community health improvement plan based on all the data we collected and reviewed for the community health assessment were these 5 areas: housing, stability and affordability, nutrition security. Both of those are under the domain of economic security. And then substance misuse, overdose prevention, and primary prevention are in the social and community context domain area. And then chronic disease prevention and prenatal care and access are both within healthcare access and quality. So these 5 priority areas fall under 3 different social determinant of health domain areas. It's taken us a while to get down all these levels. And then here again is a link to our website where again Ted and others on our team have been pulling out data to have directly on our website.
Also, I did want to reiterate that these 5 priorities were chosen based on the magnitude of the issues and the population they impact, and how feasible and what kind of impact they could make in the next 5 years. And then the ones that were not selected, they are currently being already addressed through existing work in the community. So the CHIP didn't really want to duplicate the efforts, and there is also an overlap on like several topics with the selected priorities, and will be addressed indirectly through this CHIP framework. So I think we'll take a short break here and think through the process, and then we can have an open floor and open discussion for any questions or comments about the process. And if you had a chance to review the website or read the documents, if so, then do you have any observations, questions, or suggestions?
Frank, I see you have your hand up.
Yeah, this was a very good presentation. Thank you for doing it. It seems like some of the issues never seem to go away. Um, However, of the 1,800 or so respondents, uh, was there a breakdown demographically as to where the responses came from? The reason I'm asking is an issue that might be more prevalent in, for lack of a better description, in downtown Ithaca might not be as prevalent out where I am in the town of Caroline. Transportation may be, and access to services may be at the top of the list. That I don't know that, but so I was glad to hear what Anisha said, that the other issues that didn't rise to the 5 top priorities aren't going away. They're being addressed hopefully by other organizations, but there'll be an evaluation. But back to my original question, was there some sort of a spread as to what types of answers were given depending on the location of the respondent?
Yeah, so I'm going to let Anushka respond more to that question, Frank. Thank you. And I just wanted to let folks know that we're pausing for questions now after this overview of the community health assessment process. And then the second half of our presentation is going to be going into these priority areas more for that action plan or improvement plan, and doing some breakout groups. So just wanted to set the stage for that too.
Sorry if my question was out of
No,
order,
it's not
Samantha.
at all. I just wanted to make sure folks knew that we still have some more to go. So Anushka, I'll turn it back over to you to elaborate on the community health survey though.
Thank you for your question, Frank. So yes, the survey did capture demographics, it captured municipalities, zip codes, the age group, and the gender of the respondents. And well, majority of our survey did come from city and town of Ithaca, but we did really push to disseminate it in the other parts of the um, county also. And there was, so when we compared it to the census of the county, the survey was well represented across municipalities. So we do have kind of like we do have good coverage from the municipalities. And most of the people who responded were also older adults and females. But that's like an overview. And Ted just put in a comment. We do have the community health survey reports and the results on our website, and he just put a link to it as well. So feel free to explore more about the survey.
Thank you. Thanks very much for that clarification.
Yeah.
There are definitely, Frank, there are definitely couple of the questions that specifically break out by town. And then there's others that are age. And I mean, we can dig deeper if there's something specific that you're interested in.
But
You're on mute, Frank. No, you're still on mute. All right, now.
is that better?
Yeah.
Some would appreciate that, Ted. The detail that I think, or the answer to my question, as you said, I think is if I reviewed the entire survey or the entire plan, I might get some answers to my questions. I appreciate you putting up the link.
Okay, well, you're welcome to ask questions before you find them if you want. And then we can we can show you greater detail in the documents or answer however you want. So feel free. Absolutely.
Okay, thanks, Steph.
You can also share after the meeting today with the slides for today. In June last year, Anushka and Sam shared a report, and so it's more of a consolidated, but there is some different locality information. So I'll share that with the slides as well.
I see you have a hand up, Ali. Go for it.
You might have mentioned this, but surveys are always tricky trying to get people to fill them out, right? And so was this only online, or could people call in and someone would take their answers, or did you go out and visit, and how did that happen?
Yes, so the survey was online. We also distributed paper copies. FoodNet was a partner in this. We distributed paper copies with the drivers, and then people could also call in and have their Kofa was a partner in this, so people had called Kofa, and then they really helped us to gather responses over calls. And then I personally, well, not only me, but like other colleagues at Tompkins County Whole Health actually went into communities and then sat down with people, helped them fill out the surveys. So it was a team effort and it was widely distributed. Any other questions? If not, I think we're good to move to the next part then. So here is a data snapshot of the data points that we looked at, what we call it, the data triangulation process, so like bringing in different kinds of data together to make meaning out of it and really look up the problem statements or like the issues. So addressing housing insecurity in Tompkins County is essential to decreasing homelessness, decreasing physical inadequate housing, and decreasing illness and injury caused by unsafe living spaces. So this is from the domain economic stability and the priority area called housing stability and homelessness. So as the data shows here that 13 per 10,000 residents were homeless in 2022, and 13% of the continuum of care homeless population identified as BIPOC, or like people of color, and then 40% identified as survivors of domestic violence, and 38% reported mental health disorder, 27% reported substance use disorder. And then as for the youth, 11% of the individuals staying in the shelter were between ages of 18 to 25, and then one in youth who are 1 in 4 youth identified as LGBTQ+. And individuals who are formerly incarcerated are 10 times more likely to experience homelessness. So all these data points just to give you an idea of what kind of data was pulled and how we looked at it. And then few other things, rental vacancy in Tompkins County is only at 3%. 33% of households spend more than 50% of their income on housing, and this was compared to 26% in New York State and 24% in US. So you can really see that the households are really burdened in Tompkins County. And the waitlist for Section 8 vouchers and public housing is at 2 to 2.5 years, which is a long waitlist. And then some of the qualitative data points here from our local reports. there is not enough affordable housing here, yet luxury apartments sit empty. And then another one is, I think getting housing should be an easier process. It shouldn't have to be 10 different steps. They'll say you'll get a place in 10 months, but you forget about it and move on. It definitely should be easier. So these are like some of the lived experiences of residents of Tompkins County, and then few data points pulled from federal, state, and local data sources. So this is how we kind of brought in data together to really understand the gravity of the issues. So based on what the kind of data we reviewed, we kind of selected interventions to address the health issue, like these issues, and these were adapted from the New York State Prevention Agenda Plan. The objectives were pretty much given us by the state, and the interventions, they had a list of suggested interventions that you could pick from and adapt locally to meet your local needs. So for this, for the housing issue, we selected the objective of increasing the number of people living in HUD subsidized housing in Tompkins County by 500%, 500. And then the interventions chosen for for this priority area were provide standardized screening for unmet housing security and affordability needs, and collaborate with partners to increase access to safe and affordable housing, including low barrier shelters, supportive housing, and wraparound services. So these interventions will have a family of measures, like the data that goes along with these interventions that will be tracked over the course of 5 years to really have like a sense of where we're going, what needs to improve, and where we're at. Any questions so far? So I think we could have like a short open floor here, like for like just a couple of minutes. Does anything jump out? Does this intervention resonate with your work? Or like, are there any interventions your organization is currently working on or ideas related to these objectives for housing specifically?
Can you switch back to that slide just so we can take a quick look at it?
Yeah.
I just throw in, we're always looking for accessible housing. And that's pretty hard to find in this county, along with other types of housing.
Yeah.
Anusha, does the lack of housing, are the numbers or percentages the same, say, in the city of Ithaca as compared to, say, the town of Caroline, the rural versus the suburban numbers? Is the lack of housing as big a problem in rural areas?
So we don't actually have data by municipality or zip codes or like the rural-urban divide for the county yet, but that is something we are exploring, like with the housing partners.
Okay, thank you.
Yeah.
Question about the Section 8 housing and
Mhm.
the 2 to 2.5 years that it takes. Is that a funding issue? Are there other factors involved in that? as to why it takes so long, or could the process be speeded up, or is it a limit on the number of places that will accept the Section 8 housing vouchers?
I think I'll defer this one to Sam.
Yeah, and I would defer to if there are any other housing folks on the call, like Cindy is here, but others. But I think it's probably multiple factors around just the process and availability that that there's the process it takes for people to get their Section 8 voucher, for example, and then be on a list to then like come up to be their turn for an available unit. So that is what I would say, but happy to have any others chime in, or we could get more information about it.
Is everyone on the call here today aware that the County Department of Sustainability will be undertaking an effort starting this year to develop a new county housing strategy? Yeah, I figured y'all were in the know.
Yeah, thanks, Tom.
That's
And
an
good to
important
see you.
opportunity, I think.
Yeah, and that housing snapshot just came out too from the planning department that we've definitely drawn upon. And if others haven't seen that, definitely something to take a look at it because it's really very comprehensive in the different types of housing and versus like for this plan, we're really focusing on HUD funded housing. So they're just, as we all know, housing is very complicated and all the different sort of buckets of housing and where funding streams are coming from. Yeah, it's complex. So Cindy, I see your hand up.
Yeah, just to add to that, yes, and whatever, all of those reasons that Sam gave, those are legitimate reasons. Also, we have both federal and state vouchers here, and both federal and state entities have basically paused any new housing choice vouchers. So the federal and state funding agencies are not issuing any new vouchers. So, and there are a bunch of other rules about whether or not when folks actually lose a housing choice voucher, which happens if they don't get housing within a certain number of months, that voucher is gone forever. So we're seeing like a little bit of a ratcheting down of the number of vouchers.
Thank you, Cindy. And Frank.
Yeah, I hate to bring this one up, but late last week, the New York State Appeals Court overruled part of the acceptance, part of what would permit acceptance of vouchers where landlords are concerned because of the unconstitutionality of the inspections. So it's an issue that you may want to, whoever is pursuing, and it could be county planning that might be pursuing some of the strategy that Tom just mentioned, and the outlook that it's yet another hurdle that needs to be addressed in the acceptance of the actual voucher. It gives the landlords flexibility in not accepting the vouchers, the way I understand the advisory reading. But someone who's closer to it than I, perhaps the county attorney, can advise on something like that, Tom.
Tom, go ahead.
Yeah, I'm reminded in this conversation that a while back, Get Your Green Back had a nice tool that allowed folks to look at the combined cost of housing plus transportation. Mm-hmm. Often when we're talking about housing affordability, the big issue in our community is, that folks who have lower incomes are being pushed outside of the center, and transportation is more expensive. So it's like you get more affordable housing further out, but then you add that cost back with the cost of transportation. And so I think it's been a while since that tool has been updated. Maybe folks here know more about that. I'm, still learning about all the resources that exist in the community related to transportation, which is my new role. But that was a great tool, and I think it's important that we all bear in mind, that housing plus transportation is really what we should be looking at when we talk about housing affordability, especially in Tompkins County.
Thanks. Okay, so there's always a lot more to talk about with housing, certainly. But the way that we wanted to structure this second part of our presentation was for folks to see how Anushka just walked us through sort of these highlights of data from this issue area, and then some of the suggested interventions that are pulled from the New York State Prevention Agenda that we really are tasked with aligning to that plan. We have some flexibility on adapting them a bit, and even adding to them. And so really based on your input and conversation today, plus we actually will mention this at the end too, but we have another partner survey that's going to go out probably later today or tomorrow to have different community organizations give specific input on these interventions related to their current work or what they anticipate working on in the next couple of years. And so with all of this input, we'll continue to sort of refine what these interventions look like in the plan. And so with these 3 questions in mind, we wanted to give, well, of course we're getting short on time, but we wanted to give a few minutes for folks on this call to break out into the other 4 priority areas, and have, I don't know, I guess we'll only have about 10 minutes for folks to look at the data, maybe a little bit longer. We go to 1:30? Okay. So at least 15 minutes to look through the other data highlights and the suggested interventions, and have a few minutes to discuss in a smaller group. And you can select which priority area you'd like to go to. Nicole's going to put that up on the screen so you can choose. And these questions and the data will be available in your group. So I think those are the instructions for now. And then we'll come back together to wrap up, and then Nicole and Lara will facilitate other announcements. And just one more comment from Jan. Housing. Oh, that's about the definition for accessible housing. Thank you. Okay, so Nicole, I'll turn it over to you to get us into breakout groups.
Yeah. So I think we have enough time. I think we go to 1:15 and then we'll
Okay.
come back, wrap up, and then do any announcements and updates.
Okay.
So we should have a good 20 minutes in your breakout groups. I'd let you know there are 4 areas to choose from: nutrition security, substance misuse, overdose prevention, and primary prevention. The third one's chronic disease prevention, and then prenatal care and access. So you're going to see those 4 areas pop up, and you can self-select. If you're kind of in between some, maybe wait a minute and see where other people are going and go to one of the groups that we don't have as many people. Myself, Sam, Anushka, and Lara will be kind of just there to facilitate, take notes in the Google document that you see in the chat, and then we will come back. Any questions as we get ready to go? All right, I'll give a minute warning when we're going to close those, but it'll be right around 1:15. Hi, Siobhan.
Nicole, was there a specific room you wanted me to go to?
The 4 of us can kind of self-select. Is there one you want to go to, Lara? Chronic disease, probably?
Sure.
Yeah. And then Sam, Anushka. I know we want to wait make sure people went to all groups.
Yeah.
People are selecting their groups. So we do have we have people in nutrition security. If one of you want to jump in there now.
I don't see the groups coming up on my screen.
You just have to click on join breakout room, or sometimes on those ellipses, the 3 dots, and it should pop up there.
All right, thank you.
Yeah.
Okay, I can go into nutrition security, and then Anushka and Nicole, you can choose the other two.
Yeah, we'll wait as the other two don't have anyone in them yet.
I don't see a strong overlap with our work at the Transportation Council. So just where do you want me to go?
Well, right now we have no one in substance misuse, overdose prevention, primary prevention, as well as prenatal care and access. So if either of those interest you in terms of transportation.
Where are the groups again?
So they're nutrition security.
I mean, where do I select a group?
Oh, so if you go down the bottom, it'll say more, the 3 little dots, and then it should say breakout rooms.
There's a thing that says join breakout room, which is
I
4
don't
squares.
I'm not seeing that.
4 squares together.
Am I on the wrong
Bottom.
page?
On the bottom, if you click more, you don't see join breakout group.
It's not in the more, it's in there's a
Or
little
down the bottom.
a little icon that's 4 squares. It says
Okay.
join breakout rooms under that.
Are you finding that, Jan?
No. I had an eye doctor appointment this morning. I think it's improving my ability to do a lot of things. But where would I find it?
Can you explain it? Because I'm not seeing what you guys are seeing since I created it.
Well,
I just
down at the bottom on the right, at the right of the bottom, if you go put your cursor down at the bottom, then it highlights it. All of a sudden, all these icons pop up.
Right. Yeah.
And all the way to the right, there's one with 4 squares. One of them is colored in. And under it, it says join breakout room. Or you can click the 3 dot more one and see if it's in there. I didn't see it in there.
Anushka, you can join substance misuse if you want. There's someone in there now.
Okay. Yeah, I'll do that.
And I'll add myself in there to add people. I'm not really a prenatal care person.
I don't know if Lenore and Jan left. Jan, have you had luck finding it?
Oh. Sorry, I'm jumping around a lot.
It's okay. I'm here just to make sure everyone gets to a room.
Nobody's in prenatal care access.
No, they're not.
Are we dropping that one?
I mean, if it interests you, you and I can go in there, or we could just join another one.
Yeah, none of these overlap with the main points I want to make. So I'm happy to participate in any discussion that's helpful.
Okay. They're all pretty even right now. So I think really whichever one you want to jump in.
Okay.
Honestly. Thanks, Sam.
Thanks.
I think we're all back now. All right. Sam, did you have any wrap up you wanted to say?
Yeah, we're gonna wrap up our presentation, and Tom, we got cut off, but we can definitely we'll connect offline about that other area.
Great.
Would be great. And okay, thank you all for taking time in those breakout sessions. It was really nice to speak a little more in depth about some of these areas. And I took a couple notes in the Google Docs, so maybe there are some other notes as well that we'll review and hopefully this is a good start for all of you to be thinking about these identified 5 areas more in depth, so that we are prepped for our April meeting. So for the next Health Planning Council meeting in April, we are going to select the objectives and interventions that we want to focus on. So look out for a follow-up email from Nicole that will include the full slide deck so that all of us together reviewed housing and then one other topic, but the slide deck and the website I would direct you to can allow you to review the other 3 areas that you did not look at in detail today. And then you're going to have a poll or survey to select the objectives and interventions that we're going to focus on for April. Um, and then lastly, I mentioned, I think in my group, just that, or maybe as a whole, that we're also going to send out a survey later today to all the community partners who have been part of the process and attended our convening so that different organizations can really take time to provide additional input on these suggested interventions. So again, with all this input, we're going to refine this plan that we have over the next couple months that we have to resubmit it to the state by the end of June. So that is our plan. Any last questions on that? And thank you again all for your thoughtful input. Okay, I'll turn it back over to Nicole.
So just wanted to reiterate what Sam said. I'm going to send today the slides you reviewed, as well as the Google Doc for you to add any additional input. So if everyone can try to look through that by Friday, I'm going to ask everyone to look it over by Friday, and there's going to also be a Google form to kind of rank choice the interventions. And then we're going to choose a certain amount of those at our next meeting to focus on. Karen Kaplan will be joining us to facilitate the conversation. It will be in person at the Health Department in Rice Conference Room. It is a 2-hour meeting, but we'll make sure to have a break in there. And if everyone can please, I sent it in the email, but I'll send it here as well. RSVP for the meeting. Karen's really asking for that to help prep for the meeting. As well as we need everyone to input in terms of ranking the interventions by the end of this week. So I'll send that follow-up today. I think now, Blair, we're just moving on to announcements. So I guess I'll continue talking. The only thing I wanted to share, Karen is no longer here, Karen Brown. Long-term care, we have our 2 work groups formed, discharge and transition process, which is being led by Zena from Love Living at Home. And they just had their first meeting last Friday. And that's going to start being a regular meeting. So if you're interested in participating in that, please reach out to Karen Brown, who can get you in touch with that. And then we have our falls prevention work group that hasn't met yet. But again, you can reach out to Karen Brown or myself for either of those, and we'll get you in touch for that. And also keep a lookout. We're going to be having some falls prevention training through Lemoyne Cares that's going to be coming into our community. That's still to be determined. And then the other thing I wanted to mention that was in the email I sent today, but I'll just put a reminder here. I know Cindy mentioned at the last meeting, if you have any opportunities that you can post to tompkinsopportunity.org, training opportunities, volunteer opportunities, please post it on that website. That will be helpful for those who are trying to get a waiver for the staff work requirements. And then I think lastly, just for those who are members of the Community Health and Resource Network, I just want to make a reminder, because Alex is now on maternity leave, that the next meeting is March 24th from 1 to 2, which John Mazzello will be facilitating. I think that's all for me. Pass it back to Lara. Any other announcements?
Before I open it to announcements, I just wanted to comment on the link that Nicole put in the chat. If you're not sure about finding a volunteer opportunity in your organization, but let's say you have a committee that you want to have more feedback from community members with lived experience and any of the issues that your committee is working on, this is a really nice opportunity to invite community member engagement in your committee work. So just wanted to put that out there as a potential idea. Maybe you don't have it posted on your volunteer opportunities section of your website right now, but it could be a new opportunity. Other announcements from the group? Allie put in the chat. Our tickets, is there a website yet, Allie?
Not
for
yet.
The Mac and Cheese Bowl?
Not yet. We'll be putting out our volunteer ask very soon. Just save the date for now. Put the date and time, block it off. It's super fun. And then tickets will go on sale soon.
Thanks, Allie. Other updates, announcements, shout outs?
I'm just adding in that there's a shelter, like community meeting tomorrow for the new shelter construction on Cherry Street. And so the location changed, I believe, to our conference room here at Brown Road. So folks are interested, I think they're asked to register at this link. And then the meeting will be in person here.
Can I just make a shout out to all of you all in all of the meetings that we're all in with everybody and the different, you all have big hearts and you care a lot, and it makes a big difference every single day. It's a sunny day and we've got to all be together in this because that's why we're here. We're going to make our place better for all of us. So thank you all for all that you do all the time in all the meetings.
We definitely need to celebrate ourselves sometimes too. Yeah.
You all can do that too. Come on, do it with me. We do it. Yeah.
Tom, you unmuted. Oh, no, you didn't.
I think I was trying to find the celebration button.
Okay. Well, it's really, I think this is the second meeting in a row that I've seen you here. Are you officially now part of this group, or have you just been joining because you want to be here?
Well, I think both.
Okay.
You
All
sit
right.
in
Well, that's
twice, you're
awesome.
in. You sit in twice, you're in.
Yeah, I think, we have so many silos in our work lives. One of my goals with this role is to, try to find opportunities to have common cause with partners in the health space, because transportation does play an important role in health outcomes.
Well, glad you are here. We still have a couple minutes. So for anyone who's been wondering whether they should give an announcement, you still have time.
I can just mention that Flick has got a very large grant for helping people who use home care services, primarily the CDPAP, Consumer Directed Personal Assistance. It's not to actually do what we used to do, being a fiscal intermediary. It's it's ancillary services that people might need, like if they need help filling out paperwork or they need durable medical equipment or just of anything they need. So if you know anybody or work with anyone that might benefit from that, please call us.
Thank you, Jan, and congratulations.
Yeah.
And Cindy just put the link for upcoming HSC workshops. Did you want to say something about those, Cindy?
Well, there's a board boot camp on Thursday this week, but it's booked. So I don't want to mention that, but I just did. Sorry. But if your board needs special help, please call HSC and we can help you out. There's a fundraising workshop coming up on March 24th with Brittany Campisi. So we have a lot of requests for fundraising workshops. So hopefully if you could just share widely, that would be great.
I'll also announce that at HSC, we now have Christy Taylor joined our staff as our Director of Leadership Development and Consulting. But Cindy, she's now gone today, right? She's out this week.
Yes, she's out of the country this week.
Yeah, she's out this week, but she's invited to HPC, so hopefully we can meet her next time.
All right, last call.
Lara, I wanted to recognize you, and I know Gunnar sometimes comes, but come today. I saw you on the news for the community cupboards that opened up at the Hugo Park. So
Yeah. Yeah. Thanks, Nicole. I should have mentioned that the YMCA is now operating 2 of our 3 community cupboards, which are based in clinic settings. One is at Hugo Park, the building next to Ithaca Community Gardens, and the other is at the Ithaca Mall. And they're there every other Tuesday, they're swapping. And the person that staffs the community cupboards, which by the way are food pantries, is also a screener navigator. So can screen patients, employees, caregivers for unmet social needs and get them connected to local resources. So it's a cool partnership, and the Y is doing some really amazing things related to food security as well as chronic disease prevention and self-management. So stay tuned for more on that.
Lara, where's the third one?
The third location is Schuyler Hospital, Montauk Falls.
Got it.
And we're working on a partnership with potentially Catholic Charities in Chemung County to partner with us on that pantry. All right. Well, I guess I can give 2 minutes back to your day. Our next meeting is April 13th in person, as Nicole mentioned. Hope everybody gets to enjoy some of the warm weather before it gets cold again.
Thank you, everyone.
Bye, everybody.
Thank you. Bye.
Bye.
Thank you.